Now, Walk with the Doc is an event that we offer usually quarterly, about 4 times a year. We invite a physician to join us, and he or she talks briefly about a health-related topic, and then the physician leads the walk around the mall or around the park or the trail, and this is you the chance to ask your one-on-one questions of the doctor or his staff. So right now, I am happy to introduce Dr. Sundar Munagala. He is a psychiatrist at Mercy Medical Center, as well as his staff from the Mercy Family Counseling and Mercy's outpatient psychiatry. So, Dr. Munagala, welcome.
Thank you. Good morning. Again, welcome to the Steps to Health Walk with the Doc program. I'm really excited and happy to see so many people taking steps towards good health. And basically, I'm a psychiatrist working at Mercy Outpatient Psychiatric Clinic. And I work with my team. I have 3 excellent nurse practitioners working with me in the clinic, and I have psychologists, psychotherapists. And my approach to treat mental health problems, which are very common, they are one of the top 10 causes of disability, like depression, anxiety, psychosis, substance abuse. And we treat as a group all these mental health problems. And my approach is always not only believing that medications are helping them, but I believe in a holistic approach where I feel medications, therapy, exercise, and healthy lifestyle is very important in treating our mental health problems. And everything is interconnected, mental health and physical health. If you are in good mental health, your physical health will be good. And if you are in good physical health, your mental health also will be in a good shape. So everything is interconnected. So my approach is towards working through all these things. That is the reason I came here to talk about steps to health and participate in this program. The main thing is physical activity. What type of physical activity? Anything like walking, running, jogging, swimming, and cycling, anything. Working at home, cleaning your house, all these are considered as physical activity. And the more we do them, the better is for our health. Physical activity, any type of physical activity, especially helps to improve our self-image, our body's self-image. That makes us feel good, and it makes you fully fit, physically fit, and it improves your self-esteem and self-confidence. These are very important things, self-esteem and self-confidence, to deal with the environment which we are living in. There is a lot of stress and other environmental influences acting on us, and every day you are affected by these things. So by having increased self-confidence and improved self-esteem, and you can deal with these things, these problems in a better way. When you deal with these problems in a better way, then your mental health and physical health is in a good state. The main thing what the physical activity does is it brings in changes in your chemicals and hormones in the body. And your brain produces some chemicals, and brain and spinal cord, various hormones, which are sometimes they have, due to the chemical imbalance, you have depression, anxiety, psychosis, various other problems. So this chemical imbalance leads to these. So what you do is, when you do exercise, for example, it increases the endorphins. Endorphins are feel-good hormones that are produced in your body naturally, in your brain, in the spinal cord, and also in various other parts of the body. And also it produces other neurohormones which act on your brain's cells and different parts of the brain. Each part of the brain has a different function. It helps the mood. One part of the brain helps your mood. One part of your brain helps your memory. And one part of the brain helps to how to react to your fear response. So what happens is these chemicals, when there is an imbalance, you get depression, anxiety, and other problems. So naturally, when you do exercise, some of these imbalances are corrected. Your body naturally produces. These endorphins are similar to morphine, which we take when you have a severe pain. We take morphine. But morphine is addictive. But endorphins, which are naturally produced in your body, are not addictive in nature. And the other thing is, when you do exercise, mainly in depression and anxiety, always there is a necessity of social support. And this social support is very important in our everyday life. For example, doing exercise in a group, like going to walk in a group with your friends, or doing exercise in a gym, or doing aerobic exercises, or swimming pool exercises. All this helps to get into your social network. And this social network plays a very important role in making you feel good. You exchange views. You ventilate your feelings. When you do that, it makes you feel a lot better. And so, exercise gives you physical activity and emotional comfort, which is very important for us. And also anxiety. When you do exercise, it decreases the stress level in your body. I say this through my own experience. After a day of hard work, I go and do exercise. I feel very tired when I go home. But later when I start doing exercise, I really am astonished to see how I feel, how good I feel. I can do work for another 4 or 5 hours. It makes me feel so good. It helps your muscles to relax. Because of the blood flow to your muscles is better, it helps you to relax. And there is a lot of stress in everyday life. It counteracts the stress you're going through and makes you feel better. And also the chemical changes, as I told you, helps the anxiety also. And very important thing is sleep. All of us have problems with our sleep sometime or the other. One main cause of problems with your sleep is, one is chemical imbalance, and also the other thing is pre-sleep anxiety. Before we go to sleep, we get this lot of thoughts going in our mind. We feel anxious due to various things going on in our life. Exercise decreases this pre-sleep anxiety. So when this happens, it is a good chance for you to sleep. The research has shown that increases the total sleep time. Like if you are having 5 to 6 hours, exercise improves another 1.5 hour of sleep, 1.5 hour to 2 hours of sleep. And also it decreases the number of times you wake up. I hear so many people telling us, I wake up many times in the night, doctor, 5-6 times, and it takes them long time to go back. So your sleep is so disturbed, and exercise decreases the number of times you wake up. And also it decreases the amount of time it takes you to go to sleep. Some people tell they take at least 2 to 3 hours. They just roll in the bed. And so it decreases that. And also overall it improves the good quality of sleep. When you have a good quality of sleep, you feel refreshed in the morning. You are ready to go for the day. And that is very important. And you do well the whole day. So sleep is very important. And other things are I hear a lot of problems with pain, fibromyalgia. Exercise helps a lot in all these things through changes in these chemicals like endorphins and muscle relaxation. In anxiety, the best thing that helps, apart from medication, what we do is response prevention. While we do this exposure and response prevention, while we do this, what they do is, when you are exposed to a stress, they make your muscles relax. They do relaxation exercises to make your muscles to relax and learn that habit of relaxation. And in that way, improve your anxiety. And exercise also has added benefits. As I told you, everything is interconnected. Physical health and mental health is interconnected. It strengthens your heart. It improves circulation to various body parts and lowers your blood pressure. It balances your blood sugar, and it strengthens and builds your bone. Especially as we age, all these years we are exposed to so many environmental stresses that are going on. These stresses act on your brain cells, and exercise helps the growth of the neurons and act against the stress and decreases the damage that is done to the brain cells. So even when you grow old, when you start doing exercise, your cognitive abilities, that is your memory, your thinking, your mood, everything improves. And it makes you feel better for a long periods of time. And you can ask me, what type of exercise do I need to do? Always starting is a problem. Once you start doing it, you will continue to do it. I always tell my clients, whomever I see, always have a planner and have it on your schedule. When you have it on a planner and have it on your schedule, your mind is almost like programmed. I need to do this. Then you will be able to do. Otherwise, what happens is, it's a natural tendency for us to go, I'll start today or tomorrow or after a week. But when you have on a planner, you will definitely, your mind is programmed to do that, and you will be doing that. Always go for the things which you love, which you enjoy. Don't think exercise as a chore. Think it as a fun. Like we say, every Friday they come, we are very happy the weekend has come. We think of so many things, but think of exercise. That helps you a lot. And whatever physical activities you enjoy, like running, jogging, swimming, football, or any pool, whatever activities you do. Do you prefer individual or group? It depends upon. I always, to give you more motivation, I feel going in a group would always help. And as I told you, groups helps you to have more social support also. Any physical conditions that limit your choice of exercise? If you are above 50 and have some problems, always discuss with your doctor. There is no one who would say that you cannot do exercise. There is one or the other type of exercise we can do. So always discuss with your doctor, and you can set realistic goals. Like, don't set like, today I'll start the exercise and I'll run 5 miles or 10 miles. What happens is, then you are disappointed when you're not able to do that. So gradually progress. Like today I'll go for a half a mile, tomorrow 1 mile, gradually increase it. And tailor to your plans. So we might have different types of work we do, or different activities. We have children, and we need to take care of other people. So tailor your plans to your needs and abilities. And also, always do not think that you need to spend money to do exercise. It depends upon how much you can do. And even walking, especially in winter, in states like Iowa, it's very difficult to do activities outside. And coming to the mall, walking around, or any other group activities would really help you. And if you are not doing exercise on a day or two, don't think it as a failure. Stick with it. There will be always obstacles, and there will always be days which you will not be able to do, but stick with it and continue to do it. And exercise, along improving your mood, physical activity, it improves your quality of life, which is always what we need. A good quality of life is what we need. So always think of start today. And I'm very happy to see so many people registered in this program and making steps towards a healthy lifestyle. And thank you very much for coming to the program, and good luck. And now I'll introduce Jennifer Bradley. She works in our psychiatric clinic, and she's an excellent nurse practitioner. And I'll hand over the mic to her. Thank you.
Thank you. Hello, everybody. Thanks for coming out today. It's great to see so many people. Given that this is such an important thing that we're trying to do here, I was just going to speak just a couple minutes here about seasonal affective disorder, which I think a lot of people can relate to. I mean, how many people are sick of winter right now? Anybody? I was going to actually try to count and see how many days of sun we've had in the last month, because I don't think that we've had a whole lot. Five, says the guy back here. Okay, so I'm starting to wonder if we're in Iowa or if we're in Seattle, where they don't get hardly any sun. So I just wanted to talk to you about seasonal affective disorder, which has a lot, sometimes people call it the winter blues, and talk just a little bit about what you can do to help yourselves feel better. Typically, seasonal affective disorder can happen for any season. It can happen for summer, it can happen for spring, but a lot of times we see it happening in the winter, and it just, when people are starting to get kind of down from having so many gray days and cold weather, those are normal kinds of things. So I'm just going to mention, when you're feeling that way, there's a reason for it. A lot of times it has to do with our biological clocks and our circadian rhythm. Our bodies get confused when there's not as much light. We're not sure when we should be awake. We're not sure when we should be sleeping. So that's a reason why we start to feel kind of bad, maybe kind of sad. Maybe we want to spend a little bit more time in bed. Maybe we don't feel like going out and spending time with our friends the way we like to. And part of that is because our bodies are confused. Another reason for that is we have chemicals in our bodies, chemicals like melatonin or serotonin, and sometimes those levels drop with the winter, and as a result we want to sleep more, we want to eat more. People will tell me that they're craving sweets. Does that happen to anybody here, where you want to eat a lot of carbohydrates and crave sweets and lay around the house and watch TV? Those are normal kinds of things. I'm just going to touch briefly on a few things that you can do when you start feeling that way, and then I'm going to let Jody take over and tell you when you should go talk to a doctor. When these things become too much, that you should come talk to a doctor or a nurse practitioner or even a therapist. So, some important things to do when you're feeling this way is to try to make your environment brighter. Open your blinds, turn your lights on, and try to make your environment feel more sunny. It's also very important to go outside every day, no matter what the weather is like, even just to get outside for a little bit. And like Dr. Munagala talked about, being active, getting exercise. And then trying not to sleep too much or to sleep too little. Getting proper rest. Eating healthy food. Not drinking more alcohol or doing anything to try to feel better when we're not feeling so hot. And getting together with friends. And I think most importantly, when we live in Iowa, if we're able to, we should try to go somewhere warmer if possible. So I don't know how much that's possible for people, but going somewhere warmer does help. And finally, there's equipment that's called a light box that you can actually purchase. You can have it in your home, and you would turn it on, and you would sit by this lamp for a prescribed number of minutes every day. And that does help some with mood when we're not getting enough sunlight. So those are the basics with seasonal affective disorder. And I'm going to turn it over to Jody and let her talk to you a little bit more about more severe symptoms.
My name is Jody Kolb, and I promise this will just be a minute. I know you guys have been sitting here for a long time, and the whole point is for us to get up and walk around. I do want you to know a little bit more about depression, because I think sometimes people are confused about what is depression, and don't we all get depressed sometimes, and is that really a medical problem? And the answer is yes. We all have a depressed mood from time to time. When we lose a job, or we have an argument with a loved one, or someone dies, of course we feel sad during those times. But clinical depression is something a little bit more than that, and it's actually a very serious medical illness, and one that often requires treatment. I just wanted to tell you a couple of the things that you need to be looking for depression. Some of the symptoms that you can see in depression are sadness, feeling down, irritability, drastic changes in weight, whether that's weight loss or weight gain, problems with sleeping, either not enough or too much, a lot of fatigue, energy loss, or conversely agitation or restlessness, extreme feelings of worthlessness, guilt, helplessness, hopelessness, and even sometimes some intrusive thoughts of death and dying, and sometimes even suicide. You can see that these are very different than feeling down for a few days or a few weeks, but part of diagnosing depression is these symptoms happen almost every day, all day long, for at least 2 weeks. And if you're seeing things like this, it's probably something that you need to think about talking to your primary care provider about, or seeking some therapy, or even talking to somebody like the providers that have been talking today. Once you kind of recognize what's going on, and you talk to somebody, we look at treating these things, and people are often very scared about what does it mean to treat depression, and I don't want to be on antidepressants, and I'm scared of medications. But I want you to know the medications that we have to treat depression nowadays are very good, and they work very effectively. We often will use talk therapy for people that are experiencing mild levels of depression or moderate levels of depression. But the usual recommendation is that we use medicine and talk therapy. Of course, the reason that we're here today is to talk about healthy lifestyle choices. And we're so pleased to see so many of you here, because it lets us know how seriously you take your health. Besides exercise, some of the things that we like to promote are stress reduction, doing things that you enjoy, finding time in your day every day for fun, meditation, yoga, those kinds of things. Sleep hygiene is very important. Dr. Munangala mentioned that. Nutrition, of course, and I'm not talking so much about dieting. In January we all do our New Year's resolutions and we worry about getting on a weight loss program. What I'm talking about is a well-balanced diet. Making sure you're getting plenty of fruits and veggies and complex carbs, and staying away so much from the saturated fats and the sugars. And again, one of the most easy things that you can do is start a walking program. And of course, that's why we're here today. And like I said, we're so pleased to see you all. I just wanted to reintroduce us, because you're going to have an opportunity as we walk around the mall today to be able to talk to us and ask us questions if there's anything that's on your mind, either about exercise or about mental health or depression. My name is Jody Kolb. I am a psychiatric nurse practitioner, and for those of you that don't know what a nurse practitioner is, we are advanced trained nurses who have specialized training in mental health. We can have training in many areas, but the nurses that are here today specifically have focused on mental health. Jennifer Bradley, you met, she was the one that talked before I, and then Nancy Howe is here. And we also have a therapist, Dennis LaGrange. He and a number of other people at our clinic do talk therapy with folks. And then we also have Ann Allagher, who is the director of our outpatient services, and she does a lot of administrative things as well as talk therapy. So all of these people will be available for you to talk to today. We look forward to talking to you, and thanks for coming out today. I think Lynn may have one other thing to say.
Because of the great crowd, we have 3 additional people here who have participated in walks in the past. And they are Diane Handler, if you want to stand up. She is the stroke coordinator at Mercy. We also have Pat O'Donnell, who is the heart failure coordinator. Both have been with Dr. Campbell, Dr. Young when they've done walks with the doc. And we have Rebecca Jacobs, who is the director of health and wellness services. So look for those 3 ladies in addition to the staff as we're walking. Now, this is the way the walk is going to go. Dr. Munagala is going to lead the walk, and the first person in line can fall into place and ask the question, walking one-on-one with Dr. Munagala.